when the angle between arm and trunk
is increased.
is increased, cause lower part of brachial plexus injury.
C7,
That is called
Klumbex injury.
that is called
Clum.
clump.
Klum.
Okay. C8 and T1 is injury. Ulnar nerve is injury. For this reason, all muscles of the hand is injury. All muscles of the hand is injury. Posterior muscle is good. For this reason, posterior muscle extend finger.
But they cannot.
Extend in MP finger produce this position.
Claw hand.
This position, claw hand. Full claw hand. Okay? Because all the muscles, all fingers are involved. Okay? Arm. Anterior compartment of arm, there are three muscles. One, biceps, has two head. Long head from
Superior glenoid.
to vertebrae. Okay? Long head from supraglenoid. This one is biceps. This one. Long head from supraglenoid, short head from coracoid process, and insert into the radial tuberosity. Okay? The most important topic about biceps is long head of biceps pass intra capsular and extra synovial and pass through intertubercular groove. Pass through intertubercular groove. Deep to it, we can see brachialis muscle. Brachialis muscle. Long head of biceps pass through intracapsular and extrasynovial membrane and pass through intertubercular groove of humerus. Brachialis origin from humerus and insert to ulnar tuberosity. Ulnar tuberosity. And this one, coracobrachialis, origin from coracoid, insert to medial part of the humerus. All of them are innervated by muscular conductors. All of them, no. Biceps and brachialis complete this
Flexion.
elbow flexion. Coracobrachialis, shoulder flexion. Coracobrachialis, shoulder flexion. In addition, biceps act as positions. Supination. Biceps act supination.
So supination happens by the supinator muscle and biceps.
Bicep and supinator. The tendon of the biceps insert to radial tuberosity. A part of this tendon is expanded and moved medially is called
Occipital
bicipital aponeurosis. Bicipital aponeurosis is important because form roof of cubital fossa. Bicipital aponeurosis is important because form roof of the cubital fossa. And the tendon of the biceps attached to radial tuberosity. Medial part of this tendon is expand and move medially is called bicipital aponeurosis. important because for roof of cubital fossa. Musculocutaneous nerve innervate anterior compartment muscle of the arm. Okay? The musculocutaneous nerve pass through coracobrachialis muscle between biceps and brachialis and continue as a lateral cutaneous nerve of forearm. Okay? In this figure you can see medial nerve. In upper part of the arm is lateral to artery, but crosses it, and in cubital fossa is medial to artery. The artery of the anterior compartment is brachial artery. Is continuous of axillary artery. Begins
At the lower border of
inferior
teres.
border of the teres major and divide to radial and ulnar at the level of neck of the radius.
At the neck of the humerus?
Yes. Is divided to radial and ulnar artery at the level of the neck of the radius. The brachial artery has three collateral branches. Deep or profunda brachial artery, superior and inferior ulnar collateral artery. Deep
Profound.
brachial artery and
Superior and inferior ulnar.
deep brachial is divided to anterior and posterior
Descending.
descending. The deep
Profunda.
or profunda brachial artery accompany radial nerve and pass into the radial groove. Deep or profunda brachial artery accompany the radial nerve. Both of them pass into the radial groove. Triceps muscle, posterior compartment of arm, posterior compartment of arm contain triceps muscle. The triceps has three heads. Long head from infragalenic tubercle. Lateral and medial head. Lateral and medial head. These muscles insert into the olecranon process. Insert into the olecranon process. What's the function of this muscle?
Extension.
Elbow extension. Which nerve innervates it? Radial. Okay? Cubital fossa. Cubital fossa. The cubital fossa is a depression on anterior surface of the elbow. Is bounded medially by teres major.
Pronator.
Coronal teres. Coronal teres. Is bounded medially by pronator teres, laterally by radialis, and superiorly by imaginary line between condyles. of the film. Fluor of disposa is formed. Fluor of disposa is formed by brachialis and supinator. Content of disposa from medial to lateral. From medial to lateral is medial nerve, brachial artery. Okay? Tendon of the biceps and
radial nerve.
radial nerve that is hidden by
Behind brachioradial.
brachioradius. Forearm is divided to anterior compartment and posterior. Anterior compartment, the anterior compartment has other name. Is
Flexor.
posterior
Extensor.
extensor. Anterior compartment has 8 muscles. Anterior compartment has 8 muscles. Some of them are superficial and 3 of them are deep muscles. Superficial muscles. Superficial muscles are
Brachioradialis.
pronator, nares, flexor, cardialis, okay, palmaris longus, flexor carpi, ulnaris, and flexor digitorum superficial. Flexor digitorum superficial. In this figure, you can see pronator
Flexor cardialis.
flexor
Pronator 3.
flexor carpi radialis, palmaris longus, and flexor carpi
Radialis.
ulnaris. All of them originate from medial tendon. For this reason, this tendon is called common flexor tendon. Common flexor tendon. Okay? Pronator tres end to midpoint of radius bone. Palmaris longus, flexor carpi radialis end to base of second metacarpal bone. Second metacarpal bone. Palmaris longus end to palmar aponeurosis. Palmar aponeurosis. And flexor cardialis end to base of fifth metacarpal bone. Fifth metacarpal bone. Deep muscles.
Flexor digitorum.
Flexor
Digitorum.
digitorum, flexor
Pollicis longus.
and
Pronator quadratus.
Deep muscles origin or radius or ulna. Okay? Deep muscle origin radius or ulna.
So, doctor, the intermediate letter is considered deep as well?
Yes. Superficial, flexor digitorum superficial, terminate to base of middle phalanx. Deep terminate to distal phalanx. All of them innervate by
Median.
median nerve except of flexor
So, carpi, radialis, and radial.
Point from the flexor digitorum superficial.
Okay. Okay. Mid-term of the anterior compartment or mid-term of the anterior compartment of ours, there are 2 artery and 3 nerves. 2 artery and 3 nerves. Laterally, you can see radial nerve and radial artery. Medially, you can see
Ulnar.
ulnar and
Ulnar
ulnar
artery.
artery. In mid position, you can
Median.
see
Median.
Okay? But in lower term, inverted, the radial nerve pass behind our hand. For this reason, inverted, we cannot see radial nerve. Okay? This one, show me. Okay. Evaluation of media. Anterior surface of the wrist joint, there are important relation between anatomical structure. In lateral side, you can see tendon flexor carpi radius.
Let's see you.
In medial side, you can see tendon flexor carpi ulnaris. In mid part, you can see tendon of flexor digitorum superficial or palmaris longus. Both of them are true because palmaris longus is anterior to flexor digitorum or palmaris. Lateral to this tendon, there are vessel and nerve. For example, lateral to flexor carpi ulnaris, you can see ulnar nerve and ulnar artery. Lateral to flexor carpi ulnaris. Lateral to flexor digitorum profondius or palmaris longus, you can see medial nerve. Lateral to flexor carpi radialis, you can see
Radial artery.
Radial artery. You cannot see radial nerve
Radial
because radial nerve has
behind
posterior
palmaris.
Okay. This relation is very important because for touch of pulse
Radial.
radial artery, you must find it lateral to flexor carpi radialis. Okay? Ulnar artery lateral to flexor carpi ulnaris. Why these pulsations are important? Well, I can use carotid but we use radial and flexor and ulnar.
Because you don't have any muscles here?
Good, but in diabetic person, this artery is blocked and blood circulation into the hand is stopped and fingers is necrosis. First sign for diagnosis is you cannot sense pulsation. Okay? Okay?
So because in diabetic patients we cannot sense the pulsing.
Yes.
It's blocked.
This is the first sign for a stop of circulation toward fingers.
So how?
We can find
No.
like
No,
It's in your middle.
there's a
there are no pulsation because the artery is blocked.
Yeah, but
What's the first sign for what?
In normal,
Diabetes.
normal circulation, you can sense this.
Loss of sense. Nerve.
Neuronecrosis, yani death of cells, cell death in the fingers,
No, I think you said
necrosis.
not other. Losing sense of nerve of the hand, fingers. You said that?
No.
there's a blood flow. Or it doesn't flow.
the artery in diabetic person, the artery is
Thick, thickened with fat.
constricted.
Bond strip.
Constricted. For this reason, there is no blood circulation. For this reason, you cannot touch pulsation. Okay? Because the artery is narrow.
We just can't sense where the blood is flowing.
Yes. Posterior compartment. Posterior compartment for arm. There are 11 muscles. This muscle mainly are extensor muscles, and divide to superficial and deep layer. The superficial layer origin from humans, especially lateral epicondylar. Deep layer origin
Ulnar,
from
ulnar,
radius.
ulna or radius. Which muscle forms deep layer?
The muscles for the fingers.
Muscles
Indices.
index and
Indices.
pollicis are
Pollicis.
deep. Other are superficial. Index and pollicis are deep. In addition, supinator muscle is deep. Supinator is deep. Other are superficial. In this figure,
So, doctor, the extensor digitarium indicis and the
extensor digital, extensor indices. Two muscles. Extensor digital is superficial.
and the pollicis, extensor pollicis,
Deep.
adductor and brevis as well.
Brevis, not. Brevis is in the hand.
Huh?
Brevis is in the hand.
Pollicis longus. Extensor pollicis longus. Extensor pollicis brevis. Extensor indicis and supinator. Okay? These muscles are deep layer, form deep layer. This muscle origin from radius or ulna. Other muscles origin from humerus, especially lateral condyle, form superficial layer.
And the extensor indicis as well. What about the digitarium one?
Extensor, there are two different muscles. Extensor digital for all four fingers. Extensor indicis is additional muscle only for index.
Okay.
Okay? Brachioradialis, extensor cardioradialis, longus, extensor cardioradialis brevis. The table of the crosses by abductor pollicis, extensor pollicis brevis, extensor pollicis longus. Okay? What's function of the brachioradialis?
Neutral. Neutral.
Extension? It's for extension?
Breaker.
Extension?
Neutral.
Brachioradialis is a part of posterior compartment, but function is flexion. In mid position,
Neutral.
mid position is flexor. What's nervalis muscle?
Radial nerve. Radial.
Muscle.
Radial nerve. Brachioradialis is very important because it's a part of posterior compartment, is narrated by radial nerve. But function is flexion. Attachment of muscle. Brachioradialis attached to lower end of the radius. Brachioradialis attached to lower end of the radius. Extensor carpi radialis longus and brevis. extensor capillaris longus, anterilis, and extensor carpi ulnaris. All of them attached to base of metacarpal bone. Extensor capillaris longus to second, brevis to third, extensor carpi ulnaris to
Fifth.
five.
Fifth large.
Five metacarpals. This one is deep muscles of the posterior compartment, deep muscles of the posterior compartment, for example, supinator. What is this? This one is proximal phalanx, middle phalanx, and distal phalanx. This is a tendon. This is a tendon attached to the base of distal phalanx and middle phalanx and forms special structure that is called this muscle is posterior compartment. Posterior compartment. This one is dorsal digital expansion. The tendon of extensor digitorum, the tendon of extensor digitorum divided three parts and attached to middle phalanx and distal phalanx form a special structure that is called dorsal digital expansion. Okay? For attachment of other muscles. In both sides, medial and the lateral side, attach interosseous muscles, ulnar or dorsal. In lateral side, attach additional muscle is lumbrical muscle. Lumbrical. For this reason, the dorsal digital expansion is important. Okay? In this figure, we can see attachment of pollicis muscle. Which muscle attached to first metacarpal bone?
Abductor pollicis.
Abductor pollicis. Which muscle attached to base of the proximal phalanx?
Extensor digitorum.
brevis.
No,
Distal
extensor.
phalanx. Extensor pollicis longus. Okay? Extensor pollicis brevis longus. Distal phalanx longus. Innervation of all posterior muscles of forearm is
Posterior
posterior
muscles or the
muscles.
ulnar nerve, radial nerve.
Radial nerve. Radial nerve. Okay. In this figure, we can see common interosseous branch of the ulnar artery. Common interosseous is a branch of the ulnar artery. The common interosseous is divided to anterior and posterior branch. Anterior posterior branch descends on interosseous membrane. Okay? For supply of anterior and posterior compartments. Okay? flexor retinaculum. Flexor retinaculum. The deep fascia of the forearm is thickened in anterior surface of the wrist and forms flexor retinaculum. There is a space between flexor retinaculum and carpal bones. This area is called carpal canal. Okay? Which structure passes through carpal tunnel or carpal canal? 10 structure, 9 tendons and 1 nerve. Which tendons? Flexor digitorum superficial, flexor digitorum profundus. 4 digitorum profundus, 4 digitorum superficial. Flexor pollicis longus and median nerve. And median nerve. Other structures are superficial to flexor retinaculum. For example, tendon of flexor carpi radialis, tendon of flexor carpi ulnaris, tendon of palmaris longus, ulnar artery, ulnar nerve. Okay? This structure has toward hand, what? Superficial flexor retinaculum.